Good morning and welcome back to another episode of the Dr. Mollie James Show. Today is going to be behind the scenes at the James Clinic. I have one of my besties and the Director of Operations, Katie Pace, here with us today. Welcome, Katie.
Thank you for having me. Good morning.
Yeah, good morning. So, one of the things I don't talk about enough are kind of some of the behind the scenes things that we do at the clinic that would really make a difference for people. And we get a lot of questions about this. So, I thought we'd just devote an episode to kind of some of those things that we know are really important, but maybe somebody out there doesn't know is important. And this is also on the heels of we are going to be launching an elite athlete program. I'm so excited about that. It's just around the corner. um, and you are the mom of an elite athlete. So I wanted to kind of start, we're in the throes of summer. What are
Yes.
some things you're dealing with at your house with a kiddo who's out in the heat and
Yes.
running
Well,
tail
he's a pitcher, so we have a lot of heat related activities. Um, it's really just knowledge. Knowing what his body needs going in. And I'm so thankful for you and all of the clinicians at the James Clinic, but just really knowing what he's deficient in, right? Getting a baseline of labs that we are absolutely capable of doing, and that truly most elite athletes have no idea. They're doing their best trying to feed their body all of the most important foods and nutrients, but really, if they don't know if they're deficient or MTHFR, they don't know what they need to take to fuel their body most appropriately. So we work really hard on intake, and he works out a couple hours every day. He's younger, but he is, a small adult. And so we're in that throw of we have testosterone balances and all the things that we're trying to play a role in. And hydration is huge. So all of those things wrapped up into one is something that we think about weekly when he comes, it's state baseball this weekend. So he's going to be, pitching and catching and playing in the field 6 or 7 games potentially.
Mhm. Yeah, and one of the interesting things I learned as we delved into this, and I didn't know, is when you're hydrating, it's not just water. Every third bottle of water should really be an electrolyte solution and replace those minerals. So, do you guys have a plan for that?
Yeah, so we use an electrolyte solution. He actually prefers it when he gets super dehydrated. He craves that saltiness, that extra needed. So it's not an issue for him to drink it. Some of the kids don't enjoy the taste and they go to those traditional electrolytes. I'll leave them out of this conversation for now, but they're just loaded full of junk. And so we really, we have worked together on this elite athlete line to figure out what electrolyte solution is best and how we like it best. So we really institute that, but not the day of the game. We start that a few days before or consistently, so that those are built up in his system.
Hmm. One of the other things people don't realize is these elite athletes that are working so hard, they're depleting their nutrients, they're actually at a much higher risk of having seasonal infections because
Mhm.
they're taxing their immune system. So, being ready for that, I think, is important. Your vitamin D, um, we're now using the silver to boost the immune system. Can you speak to that at all?
Oh, yes. I wish I had it down here. It is one of my new favorite products that we've brought on hand, and the silver is it's just a booster. So we have topical silver, we have silver that you can hold in your mouth and swallow. I will tell you, even my kiddos, my small kiddos do it. It doesn't have a taste or a flavor, so they don't struggle with that. Um, but we live in Iowa, and so it's surrounded by bugs and, all of the mosquitoes and everything, and it topically takes away the itchy and sting of the mosquitoes too on a totally separate, but, I've read that you can utilize it for sunburns or, anything from a skin related, so it's actually in our go bag right now.
Mhm.
I have and all moms that have elite athletes have their bag, right? It's loaded with all of the things that they have to have, and that is now in our bag, so it's
Mhm.
been pretty amazing.
Yeah, and I think having something like a sick box on hand too, where, I ran into this in our family with wrestling. We have a wrestler and they can't wrestle if they've got a ringworm infection.
Mhm.
So
Yes.
having the things on hand that you're going to need instead of having it happen and then trying to find a doctor to get into while you're against the clock wanting to compete. So I think those are important
Yeah.
things to be proactive about, and we can help do all of those things.
Mhm. I wanted to mention the Trameal piece of things. when you have elite athletes or really athletes of any kind or myself just getting older and having aches and pains, our inflammation levels go up. And instead of taking some of the traditional stuff, and Dr. James, I'll let you speak a little bit more to the science behind that. I keep the topical Trameal and the oral Trameal in my bag at all times because if I get a headache or anything like that, it's a great alternative.
Yeah, so Trameal is a homeopathic. I use it as a replacement for Tylenol, really. It has an arnica, it has some other herbals in it. There's really it's such a low dose of everything. You can take it fairly liberally. It does not affect glutathione levels like Tylenol does, and it's not hard on the stomach like ibuprofen. So it's a good thing to have in your go bag as a replacement. There's actually studies looking at using Trameal in post-op pain, and it reduced
Mm,
it as much or better than some of the other things. So
interesting.
Trameal is definitely one of the things in that go bag.
Well, I didn't even realize that, but I'm glad it's in there.
Yeah. The other thing we've dealt with together is injuries. So again, these kids have a short season that they train for all year. So if they have
Mhm.
injury in the middle of the season that benches them, they're really looking for ways to get back in the game. So can you talk about your experience with that at all?
Yes, last year, my son was playing shortstop and went and dove for a ball, and honestly, it was complete happenstance. He just landed on it just right and had, a radial fracture of his forearm. And we went to the local ortho. They were wonderful. They did everything that they needed to do, but you and I had a conversation and we knew that we could get him back sooner by pumping his system with, the nutrients and the things that it needed to heal appropriately and quickly. So, you and I met and we did infusions consistently once a week, and we sat in the hyperbaric as much as we possibly could. It was up to 3 times a week for a few weeks that we could get in there, and, instead of having the fracture and the cast for 9 weeks, at the 2.5-week mark, it was completely, you could see the calcifications where the bone was starting to heal, which is normal, but at the 4-week mark, it looked so good. You could see the cortical bone actually rehealing, and I think I shocked the ortho. He was like, "Oh, we can take this off, but I'm not sure he should go back." Well, unbeknownst to us, my son was swinging the bat with the cast on, but he didn't feel pain. And, pain is our body's receptor of when to start or stop something. And so I credit it much to the infusions and the hyperbarics and just the nutrients. And it was food-based too, we pushed the good, solid, nutrient-based food, but he got back on the field before the season was even over, and that was not expected. He shouldn't have been able to get back as soon as he did.
Yeah. So that's really important, especially in those high school years. If they're looking at scouts, they're looking at trying to get signed for college scholarships and things like that. It becomes even more important. So, the medical basis for those things, as what you well know, the vitamin infusions have high C, and in order for our bodies to heal, we need vitamin C. We need zinc to lay down that healing matrix. We need protein, so that's where the diet piece comes in. Um, it's also very anti-inflammatory, so it helps right after the injury with pain. So anybody who has an injury or who has elective surgery really needs to incorporate this because it'll expedite healing, but also reduces pain at downtime.
Mhm.
The hyperbaric is so good because it increases the amount of oxygen dissolved in the bloodstream, and we know that healing is dependent on oxygen getting to those wounds. So, as a former surgeon, I would have loved to have these tools at my disposal because those people who have tricky things that you go in and you don't have a choice, you have to operate. It would be great to have. So, it's just a reminder out there that there's a better way to do almost everything than system provides. And having somebody like us on your team will make sure you have access to those when life's events come up.
Yeah, Dr. James, correct me if I'm wrong, but I think there's a study out there about vitamin D and post-op pain and infection.
Yes. That's another thing, just optimizing vitamin D levels and doing a bump of vitamin D in that peri-op or that healing period
Mhm,
is going to be critical too, especially in orthopedic injuries.
mhm. Yeah. I also read somewhere that vitamin D was, super helpful if you've been out in the sun or you have any kind of a sunburn, the vitamin D helps boost that after. Do you have any specifics on that?
Mm. That I'm not as familiar with. I have no doubt that that's the case. One of the things we push for is healthy sun exposure
Mhm.
because that's actually going to protect you from skin cancers and things down the road. Our body needs that infrared light to heal. If you listen to Dr. Jack Cruz, who I find hysterical, but he talks a lot about this at an energy level,
Mhm.
a little bit over my head or a lot over my head, but and explains why we need those photons and those rays of light. So yeah.
So one of the other things that we utilize from an elite athlete perspective is our Theralumen red light therapy on the wrist. I actually we have a red light sauna. We are lucky enough to have that available to us. But this red light Theralumen, there has been all kinds of things and conversations about elite athletes using that in between to rehab their system. Do you have any specifics on that? Because I would love to learn that piece too.
Yeah, I don't, but I met with a developer and we have a nice YouTube video people can go watch. His name's Gene. He developed all of the light devices that we use. And he was saying basically, if you want to do red light and you have a lot of tissue, and he kind of made this indication. So um, I think he's talking about the beer belly and the little roundness that we sometimes all see, that red light has to get through all that skin to get into the bloodstream.
Mhm,
So he developed a wearable red light. It looks like a watch, and mine's not within reach, but you basically flip it so that the device part is on the back of your wrist. And then that light is exposed right to the ulnar artery where your blood is circulating. And that treatment is 15 to 20 minutes. That hits your blood volume twice as it's circulating. So it's getting all of the blood. It's right under the surface of the skin. Um, Basically, it takes clumps of red blood cells
mhm,
and separates them, which we know grounding can do, putting your bare feet in the grass.
mhm.
We know this was one of the problems with COVID is all the red blood cells stuck together and it couldn't carry oxygen as well. So the red light therapy helps those red blood cells separate so that they all have the optimal oxygen carrying capacity.
Well, the science makes sense. We're gonna try it out this weekend, so I'll report back and let you know.
Yeah, let me know. He actually gave some really interesting stories of skiers who were up in the mountains and having altitude problems and utilized the red light, and they were able to participate and ski when the day before they were really short of breath and having problems. So I think it has a lot of utility. People are really interested in red lights right now. So my biggest thing is I don't have time to drive somewhere and sit for 20 minutes in front of a red light. So to have something that's to go or I can pop on at home while I'm doing other things, uh,
Uh-huh.
really convenient. So that's been really one of the most popular things that we've had recently.
Yeah, we actually have them in, the clinics too, so if you come and do a vitamin infusion, ask
Mhm.
them, and they'll let you use the red light. Yeah, try it out.
Yeah, for sure. One of the other things along the injury pathway that we don't talk about very often is concussions,
Hmm.
those head injuries. So, unfortunately, that's part of some of the contact sports or some accidents that happen in non contact sports where people fall down and injure themselves. And I am not impressed with concussion treatment. I know when we were kids, it was basically as soon as you were not dizzy again, get back in the game.
Yep.
So, do you have any updates on that, or have you seen anybody with that?
Yeah, I haven't seen anything specific, but I've done a ton of research. It's football season coming up,
Yeah.
and the more you know, the better choices you make. I know that the helmets have come a long way. My brother's a football coach, and so I reached out to him and said, "Hey," and he's like, "The helmets have come a long way. They've got this called Q wrap." For some of the defensive players. So if they're really hitting, even if they're hitting with their shoulder and their head's involved. But some of the concussion protocols in mainstream are they're frustrating and they lack a lot of luster. And I think, one of the conversations that's about is it's all self-report. There's nothing that they can do, to, give a good example of not self-report. So if I'm a 20-year-old or an 18-year-old and I'm looking to go play the next or I'm, in a D1 sport and I'm looking to go play, well, of course I'm gonna tell them I'm good. Like, I don't wanna lose my spot. "Oh, yeah, I'm good, I'm good. I threw up last night and, the light sensitivity's there, but I'm fine. I'll be good to play." And then I go back in and I have another injury right away, that's I'm out now. And you can only have so many concussions in any one sport, so many times before your season's over. So I think that piece of things is the most frustrating that I have seen.
Mhm. one of the things we have developed a concussion protocol at James Clinic, and we're utilizing the brain gauge. So if you haven't seen the episode with Dr. Mark Tomerdal, please go back and watch that.
Really,
But brain
he's
gauge,
brilliant.
this is tied to DoD research. This is out of the Department of Navy. UNC basically has spent 20 years developing neurologic testing that's objective, and he now has left and retired, and they've put that device in something the size of a computer mouse.
Mhm,
So we're doing this assessment on all of our patients, but it's interesting where this fits in concussion because somebody can come in with a concussion, we can get a baseline assessment, and then they can actually do brain training. And they can do some of the things we offer the BDNF supplement. They can do the hyperbaric oxygen. They can do the infusions, and we can track the response and see what's helping them as they progress through that and get through it and get to the other side of the concussion faster.
yeah. I think it's wonderful that, you know, kids don't want to be benched and they'll do just about anything they can to not be. But this isn't just for kids either. This could be for adults that had, maybe they got into a car accident. Maybe, they're working with their primary care to try and get them back to work and they feel like something isn't right, but they can't put their finger on it. We're absolutely going to be able to be there to help.
Hmm. Yeah. Speaking of infusions, there
Yes,
is an infusion clinic on every corner.
there is.
And one of the things we struggle with a lot in our clinic are people who are outside of our geographic area that are looking for infusions. And it's really hard to find quality
Mhm.
um, because you have all these people who think they can cash in on a trend, which I'm glad it's a trend because I do think people get better. But you have practitioners out there that took a weekend course and they buy a product and they sell it for a lot of money and
Yeah.
it's not the best. Can
Yeah.
you explain a little bit about how we do things differently and then I'll jump into
Yeah. I think I think the number one thing that we hear, because I am oftentimes on the phone, the number one thing we hear from all of our patients or potential patients is, "Hey, I'm in Vegas for the weekend, or I'm in Florida on a golf trip or whatever, and I just feel nasty. Where can I go? What can I do?" And you have us to go out and kind of help, figure out where's best for you.
Mhm,
Um, but we don't buy premixed things for our infusions. You have spent so much time figuring out and I appreciate that so much, not for just me personally, but for our patients. You spent so much time figuring out, what the osmolarity looks like and what your body is going to be able to absorb best and what exact vitamins need to go together and in what order.
mhm,
And so it's not a McDonald's, right? You don't go and be like, I'll have this off the dollar menu. It's very precise. It's very specific and it can be specifically mixed for you. One of our patients most recently, we do B12 a lot, and we couldn't figure out what was going on. She has a B12 sensitivity, and so we now know that she has a specific mix, and she feels wonderful after that. But
mhm.
if she would have went somewhere else, they would have been like, "Oh, sorry, it must just be your body not working out." When we took the time to figure out what she needed and mix that for her specifically.
Yeah, this is a passion area for me because I'm probably the person who's had the worst response.
Mhm,
So, I had a clinic before COVID and I had just learned IV vitamin infusions. The clinic closed. And so I knew about it, but I didn't have access to doing it. So I wasn't feeling well. I was busting it in the ICU and I went in and this office had just started giving IV infusions. So I said, "Yeah, sign me up, right? I don't feel good. Give me this stuff." The minute that hit my bloodstream, I was sick, and I thought I was having an anaphylactic reaction. I felt so bad, and I literally ripped the IV out of my it was fairly dramatic. I ripped the IV out of my arm, which was a really bad idea too. Um, and I'm like, "What did you mix that in? What is that?" And I had them they restarted the IV, they gave me Benadryl. They didn't know. They didn't know what they were giving me, they didn't know what it was mixed in, and so it's really important for people to understand that so I'm an ICU doctor. I've been dealing with IV fluids my whole career. This is actually really, really important. The content of the infusions that you're given is critical to how you feel.
mhm.
So a lot of these clinics, what they do because they don't train to top of game like we do. And
Mhm.
so there's a risk component when you do it the way we do it because you have to be competent and know what you're doing. So instead of, we start with sterile water, which if you infuse somebody with sterile water, you basically burst their red blood cells because of the saltiness component. So in your body, salt follows water. So wherever there's too much water, salt will travel to balance everything out. So if we give you sterile water, it's going to pull salt from your cells to balance it out. Now, if we give you a really salty solution, guess what happens? Water comes out of your cells to buffer the salt.
Mhm.
So these clinics, they take saline, which is matches your blood salt level. Then they pour in all of these really salty vitamins and they give you a super salty formulation.
Mhm.
So I finished that infusion. I was sick for 3 days. I felt like I had a hangover because and then looking back, they gave me a 25-gram vitamin C with other stuff in it in saline, a liter. So this was probably a 900 osmoles. So it depleted my cells. The hydration in the cells went into the bloodstream to buffer this. So it
Mhm.
was like a hangover. It was like drinking alcohol. It was extremely dehydrating.
I
So
can't even fathom having that feeling after you've probably spent, 3 12s in the ICU. We call them 12s loosely because they're more like 16s. But after you've done that and then you get something like that and it just takes you down. You're completely depleted. It would be like someone, and we've had this happen. Someone go to Vegas and they come back and they're like, "I made a mistake." And we're
yeah,
like, "We got you. It's okay." But,
yeah.
detoxing your system, which brings up one of the other things that we love to give for detoxification is glutathione.
Mhm.
I don't
Yeah.
know exactly how that works, so I'm gonna let you take that one.
Yeah, I'll take that one. So again, all of our solutions are going to be mixed to match the blood chemistry. So that's really important. And when you go to an infusion place, you ask them what it's mixed in. And if they don't know, that's a red flag to me. That's you're at McDonald's of the IV world. They should be able to tell. They might not tell you the exact recipe because we don't give that as proprietary information. They should be
Mhm,
able to tell you what's mixed in. You should see it on the bag, what's in there. You can ask what the milliosmoles are, and they should be able to tell you with some
mhm,
certainty.
mhm.
Some of the people giving these don't even know what osmolarity is, which
Scary.
is really a red flag. Um, and to your point, glutathione is one of the really powerful infusions that we give either by itself or following a base infusion.
Mhm,
Glutathione is the master antioxidant in the body, but that's a separate infusion. And what we see again are these clinics throw everything in one bag. You cannot throw glutathione in a bag. It reacts with everything else.
mhm.
So if you're getting that and you're paying for all these upgrades, you're basically getting garbage.
Yep.
So you just have to go somewhere that knows precision how to mix and how to hang and sequence these IVs because that's where the magic happens.
Yeah. I think the sequence for me was so important. I have my own health journey and we don't need to get into it, but the ALA has been life changing for me. I have some neuropathy,
Hmm.
and there was nothing that touched it.
Hmm.
If it was extremely cold or extremely hot, I was miserable.
Hmm.
So we started ALA infusions, and we've realized that if you hang the ALA prior to any other vitamin infusion, it seeps down in there, and you get a quicker reaction, and I think a longer probably reaction too with the ALA. So it's definitely about sequencing and knowing what's gonna help your patient most and not trying to sell them something they don't need. It's knowing the patient and being able to tag what they need with their options.
Yeah. So ALA is one of my favorites because neuropathy is something so people deal with, and there is nothing good in standard of care medicine that really addresses it. Not anything. And we have such a good track record with that between the ALA infusions, the hyperbarics, the NAD,
Mhm.
and the PRP, which is a lot of letters I know all jumbled up there. But
Okay.
yeah, all of it together. And we actually had a patient that did PRP and happened to have an EMG, which is a nerve test
Mhm,
for the PRP and after the PRP. He's doing it for something else, but the neuropathy went away. Like it was no longer detectable on EMG. So we know in that patient, at least, I can't say for everybody, but in that patient, the neuropathy is gone.
it's gone.
Yeah. So back to the glutathione, because I
Yeah.
think there's a lot of people out there that might be like, these infusions are for people who are really sick, or these infusions are people who have all these problems. But in this hustle bustle society, really everybody could benefit from these. And there was one day, I even on a Saturday when we first opened, and a couple of my friends I gave infusions to, and both of them texted me the next day and said, "Hey, I went out last night and I have no hangover."
Yeah.
So, if you've got a big event coming up, a wedding or a social event where you may be drinking a little more alcohol than you think, loading your body up with that ahead of time can actually prevent the downside.
Mhm.
Get yourself in a pickle, literally a pickled brain. You can do it on the backside and help shorten the incidence. But I would think doing it ahead of time would be the way I'd want to go.
Yeah, and we have oral glutathione too. Can you talk a little bit about how that might mix up or how
Yeah.
that might elongate the effects?
Yeah. So the IV glutathione is going to be therapeutic in the cells for about 24 hours. So
Mhm,
you really want to target that either to do that on the back end of an infusion, or if you're going to go out on Friday night, maybe you want to do that on Friday to
mhm,
really prep your body. But not everybody can come in every 24 hours for an infusion. So what we do is the oral glutathione in between. If somebody's sick or somebody's going through a process, not cancer, this
yes,
is where knowing what you're talking about is really important.
exactly.
We're not going to do this in our cancer patients, but we're going to do it in, other people who are going through a detox. Maybe they're herxing from a chronic infection,
Mhm,
or um, anything we have where there's some stress on the body, we can add that glutathione in there and make that path smoother for them. So we do that with the oral. It's liposomal because that's a hard one to get absorbed into the body.
mhm,
We had a patient who had Parkinson's, and this is kind of an interesting. It was impressive, and I'd seen the videos on this, and I'd always wanted to try it with the patient, and had the typical very bad tremors. Came in, you got the IV in,
did. I
and
did. I
literally within 30 minutes, the tremors were gone.
and she felt amazing.
hmm Yeah, the tremors were gone, and what we did in that patient is she initially had to come in every 2 to 3 days to get the
Mhm,
glutathione to have the effects. Then we bumped her with the oral because we wanted to see how long it was lasting. Then we bumped her with oral, and she could go 5 to 7 days. So,
mhm.
a $75 infusion once a week to get your life back from Parkinson's seems to me a pretty reasonable investment.
Yeah, this person was completely, pretty much homebound. She was struggling, she was driving and maybe shouldn't have been at that point.
Mhm,
That's not for me to judge, but she didn't have any other options, and so when she was coming in and getting the infusion, she felt like she could get out of the house. She was, a little more impacted with grandchildren. She was able to go and sit in the bleachers and watch games, and she just really got her life back, and so what a heartwarming thing to be a part of and to see that specific turnaround so quickly for her, and it was within about 30 minutes. And just to give you a little idea, it wasn't early stage Parkinson's. It was we had to hold her arm, still so that I could get the IV in, and it wasn't painful for her at all. It was just she didn't have a lot of control over that. And
mhm,
so we work with our patients and we say, okay, you know, um, Parkinson's is a tricky thing, but there's some tricks of the trade of, hey, if you tap on something, it stops. And so we really trained her to say, hey, this is what we're going to do. We're going to start here. And we made the experience so enjoyable for her. And I'm just so happy that I got to be a part of that one.
mhm. Yeah, that was a good one for sure. Um, Along those lines, let's see. Oh, the other thing that we noticed with her for Parkinson's, I just while we're on this one, when she waited too long at one point to come in for an infusion, and she really had that shuffling gait. She had the
Yep.
difficulty moving, the robotic movements, the shuffling gait. It took her
Yep.
15 minutes to walk into from the
Mhm.
parking lot to our building,
Uh-huh.
shuffle. But at the end, she popped up and ran out to the car.
Yep.
It was a totally different person, and I wish we had that on video, but
It was.
just again, people who are given up in standard of care medicine, when the standard of care team, because they only have what's inside the box, they only
Yep.
have these 3 or 4 things they can offer you, and if that's not helping you, too bad, so sad. Um, we have all of these things, and it's just hard to tell people. It's hard to convey in words how much this changes people's lives every day.
Yeah. I we just got a testimony in yesterday that I wanted to read to you because it's so heartwarming. We had a patient that was diagnosed with a difficult diagnosis for them, and one of his friends, he was talking through it with one of his friends, and his friends told him, "Find the James Clinic." because they are the best out there to help. And that made me light up. And it's not because we have all the answers. It's because we aren't afraid to go and say, that didn't work, let's try this or whatever. But I would love to speak a little bit about we deal so much with those, and those Parkinson's patients come to mind because they're so life-changing, but if they can get some of these things, from a wellness before they get sick, maybe they don't get sick. And so, coming in and having that lab or having an understanding of where you're at baseline, before that all hell breaks loose kind of thing happens,
Mhm.
have a better understanding of how we can treat you quicker and get you better faster. And so that wellness piece is so important.
Yeah. And let's kind of speak to that because you and I are both pretty healthy. We're very busy
Yes.
and, we have to stay performing at a high level to get through our days.
Yes.
So let's talk about what people can do who are like us, who don't feel bad.
Yeah.
They're getting through their day, they're getting it done, they're killing it out there,
Yeah.
but they want to either stay on top of their game or they want to get the edge because it's
Yeah.
a really competitive world out there.
It is.
So let's kind of talk about some things they can do on that front.
Yeah. I think I keep going back to the labs, but they pull so much out. From a wellness perspective, especially in a female, knowing where your hormones are at and having that baseline of when you feel good, what do your hormones look like versus maybe when we get a little older, when we don't feel as good, or maybe we're not sleeping, or maybe, our cortisol levels are through the roof. If we have an understanding of what baseline is and then we redraw those labs and something's off, we can correct it quickly. And so it's really taking that step back. Um, I also think that having good supplements are huge, and those good supplements aren't from your big box store that you can order and have delivered to your house in 2 hours. It's it's the different kind of supplements that you're going to feel a difference when you take them. And so I'll let you speak to a little bit more of the supplement line, but I think those few just very minor things along with getting the infusions when "Hey, I'm gonna be traveling," or, "Hey, I have all of those things." You don't have to be sick per se to come and get the benefit of our clinic. It's actually more beneficial if you come prior to that.
Yes, absolutely. So when you're looking at supplements, people are just it's a free for all out there. And, this is unfortunately if you do it responsibly like we do, it is tightly regulated by the FDA, but it's also not tightly regulated because there's people out there selling all kinds of garbage, making all kinds of complaint of claims when
Mhm,
what they're claiming is in the product is actually not in the product
mhm,
or what's in the product is something different. So like weight
mhm.
loss things actually have thyroid hormone in them, which is
Yeah,
so super dangerous.
yeah.
Um so going somewhere with practitioner grade supplements,
Mhm.
ours are we've vetted out our
Me
supplements,
too.
not only the line we carry, we private label it. We get feedback from our patients when we bring something on, like, hey, how did this work?
Mhm.
What was your experience to make sure we're hearing positives. And we know that the things, when we recommend something, we know what it's going to do.
Yes.
So if you go to your shelf and you're getting those at the big box stores, right, where you have a membership card or something like that, those are not going to be quality supplements. They're going to have fillers, they're going to have binders, they're not going to be the most absorbable form.
Mhm,
And really, by the time you buy quality, you
mhm.
get the dose that you're looking for. You're going to save a lot of money just buying quality in the first place, like most things.
Yep.
So now, one of the things I was on with the team and just a bit ago, and they said, sometimes people are like, why am I taking all these supplements? Like, I shouldn't have to take all of these supplements. Unfortunately, food supply does not give us the nutrients that we need.
Mhm,
Uh, so we know right now that our food supply has about half the nutrients it had 50 years ago.
mhm.
And so we can't change the food supply. And at the end of the day, your body needs what it needs. And so we just want to help you get it. And if you have to take a few pills a day to boost that diet, even if you're really on point, that's what you have to do.
Yeah. I think supplementing for the deficiencies is huge because that allows your body to use what it needs so that when you are exposed to something,
Mhm.
um, just out and going to the grocery store or sitting at a kid's game, your body has what it needs to fight it off. Um, we talked very briefly about having that sick box on hand. And I think I would love to revisit that because there's so many positive things in it. And that is a really easy way to try our clinic out without becoming a concierge member. Can you tell us a little bit about how that sick box works? And
Yeah.
I can talk a little bit about how they can get it.
Yeah, for sure. Um, yeah. So we developed the sick box in COVID because we were prescribing the same thing. Everybody with upper respiratory infections, they needed it. They needed it now.
Mhm.
Everything that we have is because I saw it be a problem and challenge for people, and it just broke my heart. So if you remember during Delta, people were
Yeah.
trying, they'd get sick and then they would have to find a doctor, which
Mhm.
95% of doctors wouldn't treat it properly. So they had to find somebody, and then they had to get in and get an appointment. Then they had to figure out a pharmacy to get it filled. And then they had to figure out the supplements, and they probably going to 2 different pharmacies and a supplement store. It was a hot mess express.
Yes.
So I said, "Why don't we just put this all in one box so that people can get it ahead of time? That way when you're sick, you literally walk to the closet, you pull the box out, and you take the pills, and you skip that 18-step process I just described." So we took the best. It was designed for COVID, but it actually works for most upper respiratory, viral, and bacterial infections. We
Mhm.
do advise people to call in if they start it and they're not getting better. Let us know, of course.
Yes.
But we've got hydroxychloroquine, ivermectin, a Z pack. So that's all of your antiviral. It's your basic upper respiratory, bacterial, anti inflammatories. It's got the Cofix nasal spray to help with sinusitis.
Yes.
Pepsid to help with the fever, chills, and body aches. Really critical during COVID. It helps a lot now for different
Mhm.
things. And it has your vitamin C and your vitamin D in there. I feel
Mhm.
like I forgot something.
No, I think you hit it. I will tell you that that box is it's been huge. It's been huge for us personally from a family perspective, but just having the availability. When you're sick, you don't wanna get up. You don't wanna have to go 15 different places, and your body really can't. And then, during the COVID time, and I'm probably gonna hit some heads on here, but you're going out, and if you have to go 3 different places, guess what? You just exposed all of those people to everything that you have. And, um, I kinda giggle at that because the exposure thing, obviously, you got it from somewhere, but, when you don't feel well, you wanna be in bed, you wanna be in the shower, you wanna stay home and binge watch Netflix or whatever you have, and this gives you the capability to do that. And you do not have to be a concierge member to get that. Um, that is definitely, one of our wellness pieces and priorities that we take because we want people to have access to the things that they need when they're ill or when they're feeling great. And I think being a part of our clinic gives so many more opportunities than that. And not having to be concierge, although that will give you the most bang for your buck, in my personal opinion, and you'll be better for longer. This gives you an alternative of, if that's not in your budget or it's not something that you're willing to do right now, we can still help you on other lines.
Yeah. One of the first people who called me when I started doing early treatment, so this was in like August of 21, one of my friends went to England and got sick. And
Mhm.
so not only do we have the sick box, but when people travel internationally, I have a list of things I send them with because almost everybody has access to the internet or email that communicate with us. And wherever they are in the world, if they have some of the basic tools, we can help guide them what to take. So we can get people ready. There's no reason to be afraid or be concerned that you can't get the meds that you want and need. Um, and we check drug interactions. There's a couple of drugs that interact with ivermectin, and our patients know about them, and they have a game plan what to do ahead of time.
Uh-huh.
So we're not chasing our tail on that.
Yeah.
So that's a really important thing to have just for the preparedness side.
Yeah. I don't get on an airplane without putting that Cofix in. I just don't. And I try really hard to put it in. Cofix is super easy. There's one square up your nose on each nostril, and it's I mean, my kids will use it. It's so easy to use, and it just gives your body that extra barrier.
Mhm. Yeah. So going back to the supplements, there's about 5 things everybody should be taking just kind of as maintenance that you can't get from your diet. So a multivitamin,
Mhm,
magnesium, a B complex, a vitamin D, a fish oil, and a probiotic. Those
mhm,
are probably my foundational pieces that I would recommend for everybody. So multivitamin, B complex, vitamin D, magnesium, soy oil because we eat too many omega-6s and not enough omega-3s, and a probiotic.
Mhm.
So that's your foundational what everybody should be on. And then we add on top of that for treating for specific conditions and
Yeah.
targeted things like if you're worried about hair loss or if you're worried about, if you've got a gut infection, now we can stack and adjust based on your specific issues.
Yeah. I speaking of hair loss, I think that's one of the things that a lot of women our age are going through when they change in their hormones and things like that. And we have a couple of supplements that are specific to hair loss and are a super easy add-on that
Yeah.
from that wellness perspective is really nice to have, in our cabinet.
Yeah, that goes to thyroid. So,
Mhm.
so many people are out there and they're like, I didn't know how bad I felt until I feel good now.
Yeah.
And so
Ex
there's a lot of people running around with hypothyroidism. So I'm just
Mhm.
going to give that checklist now because this is such an easy thing. We do it all day, every day. And standard of care medicine does it so poorly. So if you are cold all the time, so I had a person tell me I go to sleep with a heating pad. Like, that's not normal. I have a heater under my desk at the swimming pool. That's not normal.
Yeah.
So if you're cold all the time, if your hair is shedding more than you think it should, I have people who are nearly bald because their thyroid is mismanaged for 10 years. Constipated. If you're a female and you have heavy periods, you have dry skin, your nails are brittle. If you're depressed, if you have brain fog and can't think, if you're fatigued and you need a nap at 2 in the afternoon every day, or you crash after work, that's not normal.
Mm-mm.
Or if you have elevated cholesterol. So if your cholesterol or your LDL are high, those are all signs of hypothyroidism.
Right.
And the reason standard medicine fails so bad on this is because they're looking at the lab work and they're like, well, your labs are okay. So the
This is
way,
one of my favorite things that you say about the lab work, so
yeah, how do they know what's a normal lab? They go out and they test 10,000 or 100,000 people. They put it on a bell curve and they say, here's where you should be. Well, half of those people are going to die of heart disease. Half of those people are going to have cancer. That is not a healthy population. And so to me, and this is actually supported by society guidelines. There was a new paper that was just written by one of our colleagues that talks about this. They don't test reverse T3. They don't test free T3. That's free T3 is the gas pedal for your metabolism. Reverse T3 is the brakes on your metabolism. A lot of doctors don't check. They check a TSH, which has nothing to do with it. They check a free T4, which has nothing to do with it. And they do an incomplete assessment, or they have a patient with Hashimoto's autoimmune thyroid and they're not telling them to eat gluten free and working on their gut. And they're replacing to make the TSH look good, not to make the patient look good.
Yep.
Such an easy fix. We have it we have it down in our office. So if you're
Yeah.
struggling with that, we've got you. You don't have to fight with us. I have a patient that just told me that for the last 20 years, she bought her thyroid meds from India and she's been managing it herself, ordering her own labs. But unfortunately, it's not going well because she tried and she got it really close, but she needs some help because she's not a clinician and she's on
Mhm.
her own.
Mhm.
So we're helping her get that corrected. She was kind of on the right path.
Yeah.
But, for people out there who are struggling, they're like, well, they said my thyroid's okay. It's probably not if you check those boxes.
Optimized is different than
Oh, and
normal.
weight gain, weight gain.
Oh, weight gain.
How did I miss that one? If you're
I don't
gaining weight,
know.
you can't lose weight.
We
How
just
did I miss that?
forgot, right? Like,
Yeah,
we see it so often that sometimes it's hard for us to pare it down because
yeah.
how many of our patients come in and they're like, "I've gained 20 pounds and nothing that I do is getting a." Well, we have so many patients that have so many positive results from that.
Yeah, and what I find too is, again, people like you and I, we have a history of being athletic. We worked out.
Yep,
Something happens in life,
it
right?
does.
Something
It does.
either you have a job, you have death in the family, you've got some kind of stressful event. For me, it was surgery residency. And life just goes off the rails and you don't know how to get it back on. And you try things and they don't work and they don't work. And you just kind of feel like you give up. But those are the patients we see. And those are the patients, it is not uncommon to drop 40 to 60
Mm-mm,
pounds. We see that
mm-mm.
all the time
Mhm. Yep.
just with getting that straight. And, again, if you're going through these stressful periods, you're putting on weight. Now your insulin level is probably high. No one even checks that. They're
Mm-mm.
checking A1C. Well, you're not diabetic. Your sugars are good. well, let's get a fasting insulin. Let's get a continuous glucose monitor. Let's see what your metabolism looks like. Let's see what you're eating.
Yeah. It's really interesting. If you've never used a glucose monitor, a continuous glucose monitor, they're super easy. I know Dr. James has put it. I usually have one on, but you put it on the back and you hook it up to your phone and it's super easy. You just tap it and forget about it. And it
Mhm.
tracks, and you will be so shocked. These valleys and peaks that you go through. And anytime we know that you have valleys and peaks, you have the inflammation factor, and inflammation is bad for everyone. And, it just creates, so if we can get those more like rolling hills versus valley and peaks, you're going to feel so much better. And that's when you're able to drop some of the weight. And we can coach you on that as well. We have an awesome nurse who works through all of those things. We love Brenda. And she spends so much time with the patients saying, okay, I'm seeing X, Y, and Z. What can we do to increase that or decrease that? And we just have so many resources on our side for those patients. So it's not hard for them to drop 40 pounds. And 10 years ago, we would have been like, oh my gosh, somebody dropped 40 pounds. That's huge. Congratulations. Now it's second nature in our clinic.
Mhm. Yeah, absolutely. So, we're coming kind of to the end of the hour, Katie.
Yeah.
So I just want to give you a chance, and I'll get a last word in here too, as far as people out there who they feel okay, but there's some things off. What's your advice to them? What did they need to know as they navigate their own health journeys?
I think you have to be your own advocate. So if you feel like something's off and everybody is telling you, no, everything looks good, I would suggest to dig a little deeper. Um, I've went through many rabbit holes just being a mom and having an elite athlete and figuring out what we need to do to best keep him in the game for as long as possible and or keep him in school, right? That's another piece of this that we didn't get to touch on because there's just not enough time in the day for us to talk through all the things. But, even if you don't have an elite athlete, even if you just have a kiddo who likes to get up and go to school and read and do the things, then maybe they can't do that. I would suggest digging deeper. Um, being a parent and being an adult right now is difficult because everyone's got an opinion. So we're happy to help you guide that. We're not going to push things on you. We're not going to push things on your children, but we will guide you and give you our best advice on how to make yourself the best you can possibly be for as long as you can be there.
Mhm. Yeah, that's great advice. And I would add to that too. Right now, our society spends about 90% of our money on sick care and about 10% on preventive care. So, and the majority of those healthcare dollars are spent in the last, I think it's 1 to 3 months of life.
Mhm.
We really need to shift that because that is not a good spend.
No,
That is money thrown away. Now, we have to take care of people at the end of life. I'm not saying
of
that.
course. Of
What
course.
we need to do, and if you think of your healthcare budget, 80% of your dollars should be going to preventive health.
Hmm.
80%. So doing those proactive labs, looking at your diet, knowing your numbers, knowing your vitamin D level. And so you need to take charge of your own health and you need to realize the system doesn't work for you. It works for its employer and it works for its insurance companies. And so they're only going to give you a subset of things that have been approved by people with major conflicts of interest. When you
Uh-huh.
come to us, we are going to give you the best advice for you without bias. We're going to point you in the right direction. And again, look at those healthcare dollars and what you're spending and where it's going. And you may need to make some financial decisions to shift that around because there is no better investment than your own health. There
None.
just isn't. So make sure you're spending wisely on that.
Yeah, absolutely. Um, I know that we have had a conversation prior to about insurance, and I could speak for 2 hours on insurance and how you can make the best benefits. And your mom, has helped so many people around this area, but also it's July and you're re-upping again at the end of the year. And I suggest taking a peek at that now and figuring out what you can do to make yourself and your family the most educated piece so that next year you have that extra dollar amount in an HSA or an FSA. And don't forget, if you're at the end of the year, you can absolutely get supplements. Those supplements have a huge shelf life and they're good for even after the expiration date on them.
Mhm. Yeah, good point. HSA, FSA, spend your healthcare dollars where you want them to go, not
Mhm.
where your insurance says they can go, not where somebody else. Don't worry about all of that. We'll help guide you.
Yeah.
So, you can learn more at jamesclinic.com. You can check out our YouTube channel at the James Clinic. We have a lot of resources there. Obviously, we talk about this a lot because it's our life, it's our day in, day out, it's our passion. So, thanks for being here. Make sure to hit subscribe, give us a rating, share this with a friend. We're still censored. I promise you so much. Thank you, Katie, for being with us. And thanks for tuning in. And I'll see you on the next episode.